While it might have moved down the news agenda, although it did feature in Boris Johnson's speech, conflict in Ukraine continues to rage with ramifications across the globe. But it is, of course, Ukrainian civilians facing the biggest challenges, and there's concern that Russia is launching a terror bombing campaign on Ukrainian hospitals and medical centres. With almost 4 attacks a day happening on average against healthcare facilities, the attacks are being labelled as psychological warfare. Iryna Nemyrovych is co-founder of the Ukrainian Healthcare Centre, which is a think tank based in Kyiv, currently documenting these bombings as war crimes. Um, Iryna, tell me first of all, I mean, I don't think we've been hearing specifically about this sort of targeted bombing. Is it really going on to the extent of sort of four attacks a day on healthcare facilities?
Yes, unfortunately, that's true. In the first 100 days of war, we had almost 200 hospitals attacked, and a lot of them are attacked numerous times. Most of these attacks are not targeted. They happen because Russians are carpet bombing the civilian infrastructure, and the hospitals are in the civilian areas. But there are some definite cases when the hospitals were deliberately hit, like the Mariupol maternal ward and a lot of other hospitals, including field hospitals. We see this like every day.
You're responding by documenting these attacks as war crimes. Can you explain what it is that you think classifies them as such?
Okay, so we're trying to collect evidence and gather the contacts of people who saw this happening. We're collecting video and photo, and we're trying to build cases together with the litigation teams so that we can use these materials in future in the criminal court. Because this thing that Russia is doing now in Ukraine is not the first time. They did exactly the same in Syria, and they got no punishment for that. They just escaped without like any legal punishment, like anything. So what we are trying to do is to cover as many attacks as possible, finding the evidence and building the litigation cases.
And is this happening all over the country still, or is it very much focused on the east now, where Russian forces are focused?
At first, it was almost all around the country because Russia was shell bombing a lot of different regions in the north, in the south, and in the east. Now, this is mostly in the east of Ukraine and in some southern districts. And for example, in Donbass, in Donetsk and Lugansk Oblast, there isn't a single hospital that wasn't hit, and there are no hospitals that can provide proper healthcare to the citizens. There are only field hospitals still operational and no hospitals for civilians at all.
In what way does this play into Russia's wider strategy, this whole scale, catastrophic carpet bombing and destruction?
So what they're trying to do, they're trying to force citizens flee the country, flee their homes, and go to another countries, to another cities. That's again what they did in Syria. They created this huge refugee crisis, but with Syria, there were only 1 million people who went to Europe. With Ukraine, we already have 6 million Ukrainians who are refugees, who are displaced to European countries mostly, and we have 12 million people internally displaced. So this is a huge catastrophe, and the citizens, they don't feel safe at home, they don't feel safe in the nearby regions, so they are fleeing the country. And for us as a country, it's a huge human capital outflow, which can be very dangerous for our future, for the future of the country, for the economy development, and a lot of other things.
That was Iryna Nemyrovych, co-founder of the Ukrainian Healthcare Centre. Grateful to her for speaking to me.